When you get into medical debt in Nebraska, or any kind of debt, the chances of a lawsuit being filed against you by debt collectors is much higher here than in many other states around the country. The 3 News Now investigators looked into why that is. Jeff Van Sant has the story.
Debt can be debilitating. If not handled, it grows and grows, sometimes taking years to pay off. Debt collectors can be unrelenting.
They are very aggressive. They can call consistently numerous times a day. I mean, I've actually had to turn my phone off.
Samantha faced years of mounting medical debt. She says her monthly medications range from $4,000 to $5,000 a month.
It's basically for my asthma and my vocal cord dysfunction issues. I have a lot of problems with my breathing. My lung function is very low.
She signed up for assistance through Nebraska Medicine and approved to have her bills fully covered. But she says there was a snafu. The bills weren't getting paid.
It's very stressful to look at $3,000 or $4,000 and then you look at your income and the outcome and it's like you knew that full well that was going to take you years to pay off. It was a never ending.
Once it's in the hands of the debt collectors, it can quickly get into the court system. A 2016 ProPublica study shows Nebraska had more than double the debt collection lawsuits of a similarly sized state of New Mexico. In 2013, there were 79,000 filings compared to just 30,000 in New Mexico. The cases were just as high last year. ProPublica reported the cost of filing a civil lawsuit in New Mexico is nearly $80. In our state, just $46.
I think it's unjust.
State Senator Adam Moorfeld says fees and rules need to change.
What it's really led to is debt collection companies being able to run roughshod over people and being able to so easily file lawsuits that people don't even have the opportunity to defend themselves or the resources to defend themselves because we've kept our court fees so low and we don't provide actual protections to people who don't have legal resources.
Senator Moorfeld says states like Illinois charges more than $200 to file in court, so they don't go after the really small debts. That's very different here in Nebraska.
So I remember that $7 one they were going to collections and like, I can give you the cash now. I literally went up to the hospital. I'm like, can I just pay it off? Because you guys obviously see it at your house. Nope, you can't. You have to pay them.
In 2017, Senator Moorfeld sponsored a bill raising the filing fee from $45 to $46. He got blowback from creditors on his $1 fee raise.
It really exposed an industry that preys on people that sometimes don't even lawfully owe that debt, who haven't even had the opportunity to have their day in court.
For Samantha, she finally got her bills paid after a long battle of stress and hours of phone calls with Nebraska Medicine. She says she wished the hospital would have handled it better.
The hospital should be an advocate for you, not you having to go through the many hours of getting help.
Jeff Van Sant, 3 News Now.
A bill sponsored by Senator Moorfeld protecting people from out-of-network medical fees. It requires hospitals to let patients know if they're being referred to a doctor not covered by the patient's health insurance. The bill was signed by the governor last month. For more on this